Welcome to Blum Center for Health. I'm Dr. Susan Blum, founder and medical director at Blum Center. Today, I have the pleasure of having a wonderful chat with Jen Jennings, one of our experienced, amazing functional and integrative medicine clinicians at Blum Center. Our hope is that you will get to know her and learn all about how she practices after watching our conversation. So with that, I'm going to turn over the mic to you, Jen. Welcome to the video. And how about just telling people about yourself? Just tell everyone who's very curious to know all about you.
Sure. Thank you, Dr. Blum. So I'm Jennifer Jennings. I'm a DNP. I am so excited to be working with the Blum Center. I have over a decade of experience in functional and integrative medicine. Own a practice as well, and so I have modalities and things such as autoimmune, cancer, Lyme, and mold, and pretty much everything that brings in functional medicine. To tell you a little bit about myself and what drew me into functional medicine was the fact that I struggled with my own autoimmune issue, Hashimoto's. It was diagnosed about 21 years ago. And I was very much into acute care, ICU, emergency medicine, trauma. But because I had struggled with my own autoimmune condition and felt as though conventional medicine wasn't serving me as comprehensively as I would have liked, I actually sought out a functional medicine provider myself and had a beautiful experience. It was quite comprehensive, and I found myself getting better. And so my wheels started turning. And I decided for myself that this was really the most rewarding way to practice medicine and to help clients so that you can look at all sorts of things from stress management to sleep, to diet, to fulfillment in life, and everything in between. So that has become my new passion. It has become my purpose in life. And to tell you a little bit about myself from a personal level, I live on 80 acres of land. I have bees and chickens and peacocks. I love to hike. I am a ski patrol person. I'm also a yoga teacher. So those are the things that I like to do in my spare time, as well as medicinal gardening and
Spare time.
Yeah. That's me.
What's in your medicinal garden?
I have a ginormous elderberry bush that is really huge blooms, so I love to harvest from that every year. I have holy basil. I have oregano, lots and lots of oregano. I have St. John's wort, all kinds of things. And then I add in, veggies this time of year.
Yeah, well, elderberry, boy, that bush got a lot of use during the recent COVID epidemic, right? In terms of supporting the immune system. So wonderful for that, right? Do you make a tincture? Do you make a syrup? Like, how do you prepare the elderberry, or tea? What do you do with it?
So I usually make a syrup that I store, and I'll actually make it with Manuka honey because Manuka honey has been found to kill just about everything in a petri dish. And then I will take actually the leftover skins, and sometimes I'll make a like either gummies, or I'll make like a fruit bark type of thing with it. Very delicious and quite medicinal. The birds love it, so they're onto it.
Wonderful. Well, that's wonderful. I wish I lived near you so that I could get a bottle of that when the winter starts. I might have to figure out a way to do that. Anyway, but thank you for that. And I know, for people sort of tuning in, you live outside Buffalo, right? So thus the ski patrol winter, that's pretty brave. It's very cold up there. So at least for my downstate New Yorker that I am, it's a little colder in Buffalo. Well, good. And so thank you for that. I think that gives everyone a really good sense of, who you are, and like a well-balanced person who is a healer and uses many modalities and healed yourself. And you're here to share what you learned healing yourself with everyone. But not only that, but you're probably doing this as long as me, 2 decades already in the integrative medicine world. So you have a lot of experience. And I think that that's one of the things I want to highlight. I mean, I know, like me, we all start out treating general autoimmunity and fatigue and all the sort of what I call like the earlier sort of imbalances until this epidemic came along of autoimmunity, right? And then we were working on that. And then the more complex people find us, right? Because we do such a good job. Functional medicine and integrative medicine is really such a great tool for helping people with complex chronic illness, which you and I have been treating for a long time. And then we find ourselves with the most complicated people. And for some reason, well, we know Lyme has become an epidemic, and we know that mold has become an epidemic, and certainly cancer has always been. And I know that those are three things that a lot of people have found you to treat. So maybe you can say a little bit more about, I guess I'm really curious about each of those things, but also about the advanced therapeutics that you use for treating some of these things, and a lot of these things which we are in the process of launching at Blum Center as well. So please.
Yeah.
So maybe talk about whichever one you want to start with.
I'll talk about my approach with Lyme and mold. You know, obviously it depends on if there's a current diagnosis or if there's just a workup that is getting started. So gathering a really detailed history in terms of, you know, birth, whether it's vaginal C-section, whether someone was breastfed, getting an idea of their immune system, getting an idea of symptoms and what types of testing they've already had done. Obviously, the conventional labs aren't always ideal in terms of looking for co-infections or even Lyme disease. So many people are walking around thinking that they are not struggling when really they just haven't had the appropriate testing. So we start with a very detailed history. We start with lots of testing in terms of functional medicine tests. If there's gut issues, we will also do a stool test. You know, we can look into heavy metals and other toxins that they might have a body burden of. And then of course we talk about treatment plans. So it depends on what their past treatment was. If it's brand new, we sort of meet patients where they are. Are they interested in antimicrobial therapies? Are they interested in herbals? Are they interested in tinctures? Are they someone who has a frequent herpes reaction that we need to be very gentle with and very sensitive? And then of course we address sleep and stress and diet and all of the things. In terms of advanced modalities, I have excessive training in things such as intravenous therapies, primarily IV vitamin C, all the additives. I have a lot of experience with detox, far infrared saunas, ozone saunas, major automated chemotherapy, even 10-pass ozone and high dose ozone and ultraviolet light. So it really depends on where someone is on their journey, how we will approach the treatment plan. But usually in cases of things like mold and Lyme, we want to take it very slow because the goal is to get to the finish line, but we want to do it in a slow, methodical, therapeutic way where the patient is still feeling well. Herx can get you a little bit closer, but it's not a pleasant experience.
No. And you know, I so appreciate how you describe your approach and starting with the immune system, right? Because really working to make sure to start out, really making sure that somebody has a well balanced and functioning immune system is critical for helping them move Lyme out, right? You need to engage your immune system to help you. The outside things we do don't do it alone, right? And the same thing with mold, where there's the foundational part, which you mentioned about like detox, and there's foundations that need to be worked on in order to help people. And then you layer on those complicated treatment modalities, which I really also appreciate that you have a lot of experience with. And so helping guide people from those early foundations and then layering on the more complicated and helpful advanced therapeutics is just exactly what people need. I mean, it's really just such a great approach. And so I appreciate how you laid that out and explained that to everybody. So perhaps we can move on to, so that's a very big, I mean, we get calls and new patients in, and we find Lyme. People might come in to see us, and I know you have this experience too, and we diagnose it all the time in people who are just really sick and don't know why. Often there's an underlying Lyme or mold. So it's not so much that people call us and say, this is what I have. It's that we find it, right, as we're working them up. Yeah. And if you don't think about Lyme and mold, then you won't diagnose it. So the good news is that we have you and me and everyone who works at Blum Center will have a lot of experience with that. I'm wondering what makes you unique amongst our providers at Blum Center, or is really one of the patient groups that you love to treat, which are cancer patients. And I was hoping you can say a little bit about that as well.
Yeah, so cancer is always a very, very troubling diagnosis. I love working with that subset of patients because I feel like my emotional approach is very strong. And that's a huge piece of managing a cancer diagnosis, is being able to manage the stress level and manage, all of the different testing. And there's a lot coming at them at one time. And so having that emotional support piece and knowing what types of modalities they will need for support is really, really important, whether it's family, whether it's counseling, whether it's meditation, yoga, etc. Approach with cancer, again, is multifactorial. We look at what could the root cause have been? Is there a genetic link? Is there a toxic component? Are they eating out of a lot of plastics? Are they getting carcinogenic exposure from things like pesticides or beauty care products? What kind of diet are they consuming? What kind of movement, exercise, lymphatic drainage are they exposed to every day, whether that's just simple movement or saunas or sweating? Do they sweat? Are they doing Epsom salt baths? All of the things in terms of detox. And when we look at detox, we really need to look at drainage pathways. It's sort of the analogy of a dirty bathtub. If you have a dirty bathtub and your drains are plugged, you can rip the drain off, but it's not going anywhere. And we can give binders and all sorts of glutathione and things. But the first thing you have to do is take a look at the drain and make sure the drain is open. And we can do that with things like lab work, making sure that you're a good methylator, looking at heavy metals, habits, tobacco use, all of the things. We also take a very close look at diet. So there are medicinal foods, there are anti-cancer foods, there are very nutrient-dense foods, there are chelating foods. So food as medicine is a very big passion of mine, because we can really highlight the diet that we're eating and make it work for us, even if it's just a matter of adding things to your water, right? Apple cider vinegar with the mother, or chlorella, or charcoal, or all of the things that are going to help you live a longer, healthier, happier life. We also know that there are certain diets that are studied in the medical literature for cancer, such as more of a paleo keto. So things that come from the earth, but are not necessarily spiking your glycemic index. Looking at stress and sleep, and your ability to just be in a healthy meditative space is very important. And so when we look at therapeutics, we look at, a lot of the therapeutics depend on blood work, of course, but then we also go to the medical literature and look for things that are science-based, evidence-based, and have been studied. And things that have been studied and have really good results are things like high-dose vitamin C. Alpha lipoic acid has a lot of information behind it from the science. We know that vitamin C can not only boost immunity, but it's actually considered a chemotherapeutic agent, believe it or not. They've actually showed that it can help with side effects of chemo and radiation. So we work with patients that are doing a conventional road, and they may want to add in a little bit of functional medicine, and that's great. We also know that vitamin C inhibits hyaluronidase, which will assist with cancer not metastasizing. That's what hyaluronidase does. And vitamin C will also help prevent apoptosis of cancer cells. We also know with alpha lipoic acid that it will decrease the cell viability in cancer cells, which is pretty interesting. Can also decrease the cancer cell proliferation and can help with apoptosis of cancer cells, which is like the bursting of cancer cells. Primarily, it's been studied in things like neuroblastoma and breast cancer. So there is a lot out in our science that unfortunately isn't being regularly used in the conventional arena. But that's what we're here for, is to meet you in the middle so that you can pull from both disciplines. There's also been science on things like mistletoe, which comes out of Canada. It's a pretty interesting modality as well, and even ozone therapy. So I like to educate patients on different ideas. I like to equip them with the science and the research so that they can share it with their oncologist if they're comfortable doing so. And I like them to feel as though they are in the driver's seat of this diagnosis.
In terms of, first of all, thank you for that. That was really very thorough, and I appreciate that. I'm sure everybody listening will really appreciate that. It made me just wonder a follow-up question about working with, I think what a lot of patients are concerned about is how we would work with someone's oncologist, right? Because a lot of the conventional oncology world is kind of afraid of their patients doing anything that they consider risky, and sometimes they consider it risky just because they don't really know about it, right, or understand it or have learned about it, just because it's not what they study, right? And so how do you integrate yourself with the care team, right, with their oncologist? Like how do you navigate that?
Yeah, you bring up a really excellent point, Dr. Blum. So what I find is that oftentimes it's just lack of knowledge, right? They haven't been taught this in medical school. They haven't been taught this in a fellowship. And so oftentimes it's just lack of information. And so I typically equip my patients with a binder and with all of the science and all of the research so that we are speaking their language, right? Medical providers want to speak a certain language. They want to make sure that things are evidence-based, they're scientifically studied, and they want to read journals. And that's the way that they, integrate things into their practice, rightly so. So some patients might say, I don't feel comfortable sharing it with my oncologist, which is fine. They can share with whom what they like. Other patients want to be equipped and they want to bring the articles and they want to share it with their oncologist. In fact, I currently have a patient who's a chiropractor who shared that he, was doing some vitamin C and alpha lipoic acid and ozone with his oncologist. She just sort of said, I don't know enough about it, wasn't extremely supportive. But now that she has seen his subsequent scans, she has said to him that she is changing her mind about vitamin C and that she's now delving into the literature a little bit more and coming up with different recommendations for her clients. So oftentimes it's just a matter of a case study. It's a matter of seeing the proof in the pudding. It's a matter of understanding the data. And so it's really up to the client whether they'd want to share it or not.
Wow, well, that is a great success story that you just shared, which is wonderful. And I'm wondering if you have any other success stories that you'd like to share with us. And actually, I was going to ask you about SIBO as well. I know that's something from the gut world that you have a lot of experience treating. And I don't know if you have a SIBO success story you want to share, as well as your, approach to SIBO for those listening. Or any other success story you want to throw out.
Yeah, so I'll share a success story and then I'll share some information about sibo. So we have a current client who was a Division I athlete, really healthy, fit, 6'4" man who was struggling with a lot of chronic fatigue. This seemed to all happen post-COVID, so it seemed to be more of a post-COVID situation. He had been to Cleveland Clinic, he had been to GI, he had been to neuro, he was having tinnitus and vertigo and GI issues and all sorts of things. The fatigue was so intractable that he actually had to stop working. And his family was really quite concerned about him, and nobody really could seem to figure out what was going on and why this was happening to somebody who was ordinarily young and healthy. He was in his early 20s. And so, Cleveland Clinic really couldn't offer much. It seemed like a lot of the doctors he was seeing, even the cardiologist for his tachycardia, they were just layering on more pharmaceuticals. So we took a very comprehensive approach, looking at mitochondrial antibodies, looking at carnitine, looking at thyroid, serotonin levels, lithium, all kinds of things. We, in some of these cases, have to cast the net very, very wide, adding in a lot of functional medicine testing, whether that's heavy metal testing or stool testing, all of the things. It's really sort of discerned through a very good history what you want to order. I really try to keep things financially sound for a lot of my patients because we really need to focus on the need to have and not necessarily the nice to have, and that comes with treatments as well. Long story short, we fixed all of his micronutrient deficiencies. We fixed the inflammatory issues. We put him on a protocol where he was getting an executive stress IV, which has a lot of amino acids in it. It has higher doses of vitamin C. We also gave him some ozone therapy with ultraviolet, and we slowly titrated his doses up. Well, he's now about 15 to 20 treatments in, and he's going on for his master's degree. He just accepted a sales job. His family has come in to thank us. I mean, he is completely transformed to the point where he's written us letters and brings us coffee and bagels,
nice.
and even said that his demeanor has returned, that he's laughing again and he's joking and he's living again. And so, you know, sometimes functional medicine has a place with these very, very complex cases where we need to tease through the data, right? It really takes such a detailed history to try to figure out what was the straw that broke the camel's back, and how can we get this person not only back to functional status, but living a life with vigor. And so he has been a really fantastic success story. We often get letters from patients that will just bring you to tears because they're doing well. We have another architect who also is doing conventional and functional therapeutics for his cancer. And him and the chiropractor that I talked about have been, you know, declared cancer-free. So really, really rewarding, you know, but it's really, I always tell my patients, it's you in the driver's seat. I am telling you to turn right or left or to stop, but it's really the patient that is making the substantive changes so that they can be on the road to wellness.
Right. Well, excellent. And that's probably a very, I mean, we know post-COVID, there are a lot of people suffering with long COVID, you know, out there. And it's really wonderful to hear your approach to it and how you helped this young man. So there's definitely, I think not all long COVID cases are the same, which I know you know. But wow, that's really awesome. I was hoping you could tell us about a little bit about SIBO and about your approach to treating people with SIBO. Maybe
Yes.
what is it and how do you work with patients?
Thank you for asking. So what I love to tell patients is that I've struggled with it myself. So I do understand the symptoms and I do understand the chronicity of it. So if you look at the research on SIBO, it does have a very high failure rate. And so sadly enough, most patients are going to their GI. They may or may not get tested for it. If they do, oftentimes they're given a very, very strong, powerful antimicrobial. And the science shows that the failure rate is really pretty high. So it does take a very detailed history on your digestibility, you know, the food that you're eating, bloating, gassing, elimination, making sure that you're changing the milieu, you're changing the environment so that it doesn't return. And so really what the science shows is that there's 2 supplements that are antimicrobial that have been studied in comparison to rifaximin that has about the same success rate. And so why do we want to blast the GI tract and get rid of all the good and all the bad and make more of a sterile environment when we could use things that are herbal and they're a little bit more long lasting, and we can address everything else to make sure that the SIBO is taken care of once and for all. I really try to be realistic with patients that it can take a little bit of time to get past it. This is not an overnight fix. It's not a fix in a month or 2 months. It takes some rigorous dietary changes. We really have to zoom out and say, are there underlying food allergies? Is there any sort of genetic predisposition to celiac? Is there celiac? Is there non-celiac gluten intolerance? What is your HCl production? What kind of things are you adding to your diet to help with HCl production? What kind of foods are triggering you? And then getting you on an appropriate diet for SIBO and being sure that we're feeding your good bacteria with prebiotic rich foods, being sure that we're zooming way out to take a look at not only one gas producing bacteria, but there's actually 3. And so sometimes people will come back with a negative because many providers are not checking for 3. And so that's a really important component, is knowing what you're treating and why you're treating, and even being prescriptive with probiotics, because we know that there's good bacteria and there's bad bacteria. And then there's good bacteria that's completely lacking. And so we can do that with prebiotic rich foods. We can do that with foods that help to support the microbiome.
Good. Well, I know that for me, for me, I use a combination. Sometimes people prefer, it's like you said, in terms of Lyme treatment, right? Sometimes people really want to try the antibiotics, and so I'll prescribe them, but I tend to prefer herbs as well, or an herbal antibiotic, as we call it. And I love how you're describing really how I sort of reframe what I just heard is really going upstream to figure out how you get SIBO to begin with, right? You can't just throw things at it, right? To try to treat the symptoms. It's like, why does this person have SIBO? Are they eating the wrong foods? They have a motility issue. Is it digestive power? Like what's happening in the digestive system? And so really, otherwise it'll just keep coming back, right? So we're back to the good old root cause medicine, right? Which we love to do. So, so good. And I'm happy for you. I'm glad for you that you cured your own SIBO, because it's not a fun thing to walk around with those symptoms. So, okay, well, great. So is there anything else you'd like to add before we wrap ourselves up?
Just that, really taking care of clients and patients is a passion of mine. I find such fulfillment in difficult, complex cases. I feel like investigative work is really my passion. The harder the case, the more energized I am. I'm known to wake up at 3 a.m. thinking about my patients and thinking about different ideas and modalities. So I'm just delighted to be with the brain power of the Blum Center. And I would love to work with anyone who would be interested in seeing me.
Well, awesome. Well, thank you so much. And everybody who's listening, I hope if you have any questions, please reach out to us. And I'm glad you all got to know Jen.